How might an Adlerian therapist treat obsessive-compulsive disorder? An Adlerian therapist would approach obsessive-compulsive disorder from the perspective of individual psychology, focusing on the client's unique lifestyle and their striving for significance or superiority in the face of perceived inferiority feelings. Unlike Freudian and Jungian approaches, Adlerian therapy places less emphasis on unconscious drives or archetypes and more on conscious goals, social interest, and individuals' subjective interpretation of their experiences. Here's how an Adlerian analyst might treat OCD based on Adlerian theory. Core Adlerian concepts applied to OCD. Feelings of inferiority and striving for superiority significance. Adler believed that all humans experience inherent feelings of inferiority from childhood. These feelings motivate us to strive for superiority or significance. In OCD, this striving might be misdirected. The elaborate rituals and strict adherence to rules could be seen as an attempt to achieve a sense of perfect control, certainty, or competence in a specific area, thereby compensating for underlying feelings of inadequacy or lack of control in other areas of life. The compulsions provide a fictional final goal of absolute certainty or safety, which is ultimately unattainable. Mistaken goals and private logic. The obsessive thoughts and compulsive behaviors are viewed as part of a mistaken goal or private logic that the individual has developed to cope with life's challenges and secure a sense of belonging or significance. For example, a person with contamination OCD might have a mistaken belief that by being perfectly clean they can achieve absolute safety and avoid disapproval, or that is the only way that they can feel competent and in control. Lack of social interest. Adler believed that mental health is strongly linked to social interest, a sense of belonging, connection, and contribution to the community. OCD, with its isolating rituals and self-absorption, might be seen as a manifestation of discouraged social interest. The individual's energy is consumed by their internal struggle, hindering their ability to engage constructively with others and contribute to society. Lifestyle assessment. The therapist would aim to understand the client's overall lifestyle, their unique way of thinking, feeling, and acting that forms a consistent pattern. This includes exploring early recollections, family constellations, birth order, relationship with siblings and parents, and current social relationships to uncover the origins and purpose of the OCD symptoms within the broader context of their life. Purposeful behavior. Adler believed that all behavior is purposeful, even if the purpose is unconscious. The OCD symptoms are not random, but serve to function for the individual, often to gain a sense of control, avoid perceived threats, or maintain a fictional sense of safety or perfection. Treatment approach. The Adlerian therapist would typically follow 4 phases. 1, establish a therapeutic relationship or engagement. Build a collaborative, egalitarian, and trusting relationship. Demonstrate empathy, respect, and encouragement. Normalize feelings and acknowledge the client's subjective experience. 2, assessment and analysis of the client's dynamics. Assessment. Lifestyle assessment. Explore the client's private logic, mistaken goals, and their subjective view of themselves, others, and the world. Early recollections. Ask about the earliest childhood memories to gain insight into their fundamental beliefs and themes. Family constellation. Discuss birth order and family dynamics to understand the influences of their personality and coping mechanisms. The question. A classic Adlerian technique. What would be different if you didn't have this problem? This helps reveal the underlying purpose of the symptoms. For example, if I didn't have OCD, I would have to take risks and then I might fail. 3, encouraging understanding, self-understanding, and insight. Help the client gain insight into the purpose of their OCD symptoms, how these behaviors serve their mistaken goals and attempt to compensate for inferiority feelings. Gently challenge their private logic and mistaken goals by using Socratic questioning. Could it be true that, or what if? Help them see the self-defeating nature of their perfectionistic strivings and the isolation caused by their focus on rituals. And finally, reorientation and re-education. Encouragement. This is a core Adlerian principle. The therapist actively encourages the client, focusing on their strengths and efforts, and fostering a belief in their capacity to change. This is crucial for overcoming the discouragement often associated with OCD. Developing social interests. Encourage the client to shift their focus from self-protection and perfection to engaging with others and contributing to the community. This might involve setting goals related to social connection and helping others. Challenging perfectionism. Help the client recognize that good enough is sufficient and that striving for unattainable perfection leads to anxiety and paralysis. Goal setting. Collaboratively set new constructive goals that align with social interest and healthy striving, rather than mistaken goals driven by inferiority. Acting as if. Encourage the client to act as if they were already the person they want to be, even in the face of anxiety, to build new habits and confidence. And breaking the cycle. While not direct ERP, exposure and response prevention, the reorientation phase would involve helping the client gradually experiment with reducing compulsive behaviors and tolerating uncertainty, seeing these actions as steps towards a more fulfilling, socially connected life. Distinction from other approaches. Focus on purpose. Adlerian therapy is highly teleological or goal-oriented, emphasizing the purpose of behavior rather than just its origins. Social context. Strong emphasis on the individual within their social context and the importance of social interest. Less on unconscious drives. While acknowledging the unconscious, it's not the primary focus in the same way as Freudian or Jungian analysis. The private logic is often closer to conscious awareness. And empowerment and responsibility. Clients are viewed as capable of change and responsible for their choices rather than victims of their past or unconscious forces. While Adlerian therapy may offer a valuable framework for understanding the underlying motivations and lifestyle patterns contributing to OCD, it's generally not considered a primary, empirically supported treatment for OCD in the same way that cognitive behavioral therapy or exposure and response prevention is. However, its emphasis on encouragement, social interest, and challenging mistaken beliefs can be a valuable adjunct or a choice for individuals seeking a more holistic and meaning-oriented approach to their struggles. What do you think? Do you want to be treated with Adlerian therapy for OCD? Leave your thoughts in the comments. Speak to you next time.